Hi, I'm Sarah. I'm a pharmacist and I run a pharmacy in Price Hill. So we partner with this project because we have a lot of patients who do have uncontrolled blood pressure, uncontrolled hypertension. So we wanted to see what we could do on the community pharmacy side. So when we see you with your refills, or we see you with new prescriptions, or we see you when we deliver to you, can we be involved in the same thing, getting people to take their meds correctly, to take their monitor their blood pressure, all those things. I call this 5 questions you should always ask your pharmacist. I preface that with the pharmacist should be someone you know, should be someone you're always willing to ask a question to. Even if they seem busy, they truly do want to answer your question. That's the best part of their job, not putting pills in a bottle. The best part of their job is talking to patients. First question, you should always ask your pharmacist. So this is based on I have a new medication or I have a change in medication. I just went to my doctor. What should I know? So first question, I have a new medication or I have a change in my medication. Can I take this medicine with the other medicines I'm taking? We, as a pharmacist and as a pharmacy, we look at all the things we have in our computer against what you're getting. We truly do. But that comes with some things where sometimes we don't always fill all the medications that you take. So you have to really make sure that your pharmacist knows everything that you're taking. Because sometimes you'll get a specialty pharmacy medicine, something that pharmacy can't fill. So you should always make sure that your pharmacist always has all of the medications that you're taking. So we can check against all of them. So that's the first thing. So make sure your pharmacy, if they don't fill everything, they know everything that you're taking. And then when you get a new medication, say I got a new blood pressure medicine, right? So my blood pressure was high, doctor's gonna put me on a second medication. You should say to the pharmacy, okay, I'm taking another blood pressure medication so that we know that they didn't stop the other one, because sometimes we don't get that message from the doctor. So we wanna know, are you taking a second medicine or are we changing the medicine, right? So that's good to talk to your pharmacist about. And if we're changing another medication, where does it fit in your daily medicine? So you're taking your one blood pressure medication in the morning. Should you take them at the same time or should you split them up? That's a huge thing in hypertension medicine. A lot of times if you start on a second medication and it's not a combined pill, sometimes we'll split them up because sometimes that does help. But that's a good thing to strategize with your pharmacist about, right? When to take your medicine. Or if you were taking a blood pressure medicine in the morning and that's the only medication you take, I don't want to complicate your life and say, take it at bedtime or something. I want you to take it together because I want it to be as easy as possible. My job is to make your medicine daily routine as easy as possible. If you ask, what is the most important thing I need to know about this medicine? Do not take it with vitamins, or must be taken on an empty stomach, or must be taken at bedtime, right? There's always usually one big thing that we can counsel you on that you'll remember, right? So what is the most common side effect? I'm gonna take this and I'll probably have dizziness for a couple days, right? I'm gonna take this, it's gonna upset my stomach, I need to take it with some food. Don't take it on an empty stomach, you'll be sick. There's usually one thing that you'll remember about it that's the most important thing. So we talked about the pharmacist should know, or the pharmacy should know all the prescription medications you're taking. We also need to know what you're taking for vitamins and supplements. I know they're over the counter. Sometimes people think, oh, well, it doesn't matter what I take over the counter. These are my prescriptions and these are my supplements. Some of those supplements can really interact with some of your medications. So, and again, a lot of times we aren't filling those supplements or we aren't filling those vitamins. We don't have them in your profile. We can't check against your other medicine. So just, communicate with your pharmacist, and there's usually a way they can keep a note or something about what over-the-counters you take. And there's not a lot that are a big problem, right? A lot of them, vitamin C and calcium and vitamin D are usually not a problem with your other medicine, but some things are. So there's a supplement called St. John's wort, which essentially acts like an antidepressant medicine called Prozac. So like if you're taking both of those, we would want to know, right? So maybe you're self-medicating, you're taking the St. John's wort at home, you go to your doctor, you express some feelings that, you're having some depression. They don't know you're taking it. I don't know you're taking it. They put you on Prozac. Now we're doubling up, right? So just things like that where there are reasons we should know kind of everything that you're taking. And sometimes we don't think about vitamins as medicine, right? It's over the counter. We just, we buy it at Walmart. We put it in our cart. We don't think about it. But it's something to, or even like if, I drink an energy drink twice a day, right? That's a lot of caffeine. I need to know. We need to know that, right? It might be okay. It might not be okay. It might be a discussion, but we can manage some of your other medicines or other side effects if we know kind of those kinds of things, okay? So this is a big one. A lot of people say like, am I gonna have a side effect? How am I gonna feel? Am I gonna know it's working, right? Like, how will I know? Unfortunately, with a lot of medicines, you won't know it's working by how you feel, right? You'll know how it's working because you've gone back to your doctor and done a follow-up blood test. You will monitor your blood pressure either at home or at the pharmacy or with your provider. But some things you'll know. The rash got better. I'm taking an antibiotic. I'm feeling better. But it is something that you should ask, because if it's something where if you have an infection and I say to you, you should feel better in a couple days, and you don't feel better in a couple days, then you should follow up on that. Or say to you like, how will I feel if this is working? If I say to you, you won't feel that it's working, you need to follow up with your doctor, then that's an important thing for me to say. Like, you need to make sure you make that 3-month follow-up, because they need to do a blood test and know that your thyroid levels are back to where they need to be or whatever it is. So it's one of those things where medicine is so good and it fixes you that you don't know you're fixed. And so we need to make sure that we are following up on those things. And again, like if you don't remember when you were supposed to follow up, or you don't remember what it was supposed to make you feel like, you call us and we'll be like, oh, remember, you have to go get your blood test, So if you have a severe side effect, right? So you have, your blood pressure dips that low, you need to call somebody, you need to go in. Or you have a rash all over your body, like that's probably allergic, right? You feel your throat closing, your face has swelling to it. That's one of the blood pressure drugs can sometimes cause some facial swelling. That's stop the medication. And, if it's something where you are feeling really physically unwell, that's a go to the ER, right? Or call your provider. If it's something that's bothering you, so again, another blood pressure medicine can cause a little irritating cough, and you're like, is this the medicine? Is this allergies, right? Call your pharmacist, right? Have a discussion about, what do you think this is? Like, do you think it's because there's a lot of pollen this week? How long have you had this little cough? And we try to tie it back, like in time, like, oh, you started taking that lisinopril 2 months ago, and you've had this little cough growing. We'll talk, then we call your doctor and say, hey, let's get them in, let's figure out, do they want to stop this medication? So most importantly, my words of wisdom, please use your pharmacist. Like, we truly want to help you. I said, the best part of our day is talking to you. It is not putting pills in a bottle. It's not putting a label on a bottle. Like, that's not the best part of our day. The best part of our day is helping you take your medicines correctly. So we want to use that knowledge. We want to talk to patients. We want you to take the medication in the best way possible, right? And sometimes that's just having a conversation, and something will come out in the conversation where I think, oh, and then I'll say, what about this? And then we'll figure it out, right? It's just about the conversation. So please call us. Make us a person on your team, right? Like, you have a doctor and you have a specialist, and you have your family that's supporting you. Let us be part of that group. We really do want to be part of it.